Have you ever walked out of a doctor's visit and thought, I barely got 5 minutes and didn't even get to finish my sentence? Most people today think that's just how medicine works, but it doesn't have to. There is a movement happening across the country, family doctors stepping out of the insurance treadmill and stepping back towards actual human care. It's called direct primary care, and here's how it works. Instead of billing insurance for every single visit, phone call, and code, patients join the practice with a flat monthly membership, kind of like a gym or Netflix. That membership gives them direct access to their doctor through text, calling, telehealth, or in person, without copays or surprise bills. And that one simple shift changes everything. Because when we stop being paid per visit number, we stop rushing. We start listening again. We start asking deeper questions. We start knowing our patients, not as a diagnostic code, but as a whole person with context, fears, goals, family, and dreams. In direct primary care, a follow-up text message or after-hour phone call isn't a billing problem. It's just caring for someone you know. A same-day visit for a sick kid with a fever isn't a scheduling crisis. It's just being available. A long visit to talk about preventing diabetes or reversing high blood pressure isn't lost revenue, it's the point. And what's wild is that when you take out the middle layer of bureaucracy, most day-to-day medical care becomes remarkably affordable. In many DPC clinics, the cost of basic labs is often 80 to 90% cheaper than insurance prices because they're not marked up. Generic medications can be dispensed at wholesale cost right out of the office, sometimes cheaper than your pharmacy. It feels like medicine the way your grandparents talked about it, but with modern tools. Text, video, online labs, right in your phone. Patients still keep insurance for hospitalizations, ER visits, big surgeries, that makes sense. But for everyday healthcare, the colds, the migraines, the blood pressure checks, the menopause symptoms, the cholesterol recheck, the anxiety flare, the med adjustment, strategies to enhance your health and not just treat disease. Direct primary care turns healthcare back into a relationship, not a transaction. It's more access, more time, more clarity, more follow-through. It's a medicine that moves us forward instead of wearing us down. And maybe most importantly, it restores one of the most human parts of medicine, trust. Because when you can text your doctor, when the visits are unhurried, when your questions aren't extra billing units, people open up. They tell the truth. They share the real stuff. And that is where healing actually begins. So if you've ever wondered if your healthcare experience could feel different, more personal, more accessible, more human, it can. That is the heart of direct primary care. And that is why it's growing. Because deep down, people know what good medicine feels like. It feels like being seen. I'm Dr. Steve King, owner of Simple Primary Care Solutions.